This was a randomized controlled trial that was performed at Good Samaritan Regional Medical Center. The goal of this study was to determine if giving tranexamic acid at the time of hospital admission would reduce the postoperative transfusion rate in patients with extracapsular hip fractures. There were 100 patients recruited in the study. After exclusion due to things like surgery being canceled and patient dropout, there were 40 patients in the TXA group and 49 patients in the placebo group. The overall blood transfusion rate in the tranexamic acid patients was 17.5% compared to 36.7% in the placebo group. Therefore, this was statistically significant that patients that did receive the tranexamic acid had a reduction in transfusion rate. In addition, we looked at total blood loss, length of hospital stay, and 30-day mortality rate, and we found no statistically significant difference between the two groups. In addition, we did look at intraoperative surgical blood loss between the two groups, and we found that there was no significant difference in these two groups. We also performed a subgroup analysis to look at any patients that were given the drug within 3 hours of surgery being excluded, and we found within this patient population there was 15.2% risk of transfusion rate in the TXA group, whereas there was 40% in the placebo group. Therefore, we concluded from this study that giving a dose of 1 gram of tranexamic acid to patients with extracapsular hip fractures at the time of hospital admission significantly reduces the rate of blood transfusion. Therefore, this has changed the practice in the orthopedic department and Good Samaritan Regional Medical Center, and all of these patients now receive 1 gram of tranexamic acid at the time of hospital admission. Thank you.